Good afternoon. My name is Chris Barrera, and I'm your moderator for today. We'll be doing the session Employee Vaccinations. We also have in attendance Yash Chitre, who is our SVP of Engagement and co-founder of HubEngage. We also have Tom Rich attending. He's our VP of Global Sales. So they'll be moderating and being able to monitor for questions and anything like that during the webinar. I'd like to thank HubEngage for their commitment to our CE webinars for HR professionals and others. We also recently added HRCI to our CE portfolio. That's the Human Resource Certification Institute. That was approved late last week. Unfortunately, for this particular session, we weren't able to get a pre-approval for HRCI, but we will in future events be able to do both certifications. And if you're like me and you have dual certifications, we'll be able to help you maintain those from both organizations. A little bit of housekeeping. All participants will be on mute. We'll have some time at the end of the webinar for questions and additional discussion. If you have a question during the session and while we're on a particular slide, please go ahead and ask it right then and there. That way, if I have a chance, I'll answer it at that time, or we'll save it to the end of the webinar. But it give you an opportunity to put that question out there and not forget it a little bit later on down in the webinar. There will be a form required to be filled out at the end of the webinar. That'll be via Google form. There'll be a link in the chat box. We'll gather some information so that you can create your CE certificate, and that CE certificate will have the activity ID number, which is what you enter into the SHRM website to be able to get credit and CE for that particular course that's been pre-approved. As you know, SHRM requires that you have 60 PDCs every 3 years. Our HubEngage is committed to providing at least one webinar each month, 12 hours annually for both SHRM and HRCI going forward. We recommend that you log into your CE portals regularly and add your PDCs with the activity number so it doesn't become such a chore at your renewal period to be able to track and get that information into your portal. If you have any questions on recertification, please visit the SHRM website, or you can email me directly as well at chris@hubengage.com. Legal disclaimer. This webinar is not designed as legal advice or law interpretation. This webinar is designed to provide you with information. The COVID-19 vaccine mandate is still a gray area and regulatory limbo continues. Each organization's needs are unique, so please refer to your legal counsel or HR departments before implementing any program or policy. So what we're covering today in the Employee Vaccinations webinar, we'll be discussing COVID-19 current trends. We'll be discussing COVID-19 current vaccine trends. And the big question, I think, for this particular webinar is whether or not employers should encourage or mandate vaccines. We'll be providing you quite a bit of information to help you make that determination. We'll discuss some potential legal issues that come from either mandating or administering voluntary programs for vaccines. We will review COVID-19 vaccine best practices, COVID-19 policies and other tools that are available to you, and then lastly, any COVID-19 vaccine resources. All right, so several months ago, as we were planning our CE webinar topics, we chose as one of our topics employee vaccinations. The reason for this topic is that we felt like it was a current event, and really all of our topics that we've been doing are current events and things that we felt employers would want to know more about. We were excited to put this course together and share this information. So, we do take a lot of pride in being able to provide these to you. In the upcoming weeks, we decided that we would promote the webinars through several social media platforms. And we were very surprised by the overwhelming response that we received on the topic. There were literally thousands of views and hundreds of posts in social media on the topic. Certainly a mix of opinions that were really kind of all over the place. And at the end, our intent wasn't to create controversy, but just to educate employers on the topic of employee vaccinations. As of this date, this webinar on how employee vaccines are administered in the workplace are still a very gray area for most organizations, and navigating the law is extremely complicated. As with COVID-19, as with the COVID-19 landscape and how we address COVID-19 in the world is currently changing rapidly and frequently. We must be able to adapt quickly. Today's webinar is focused on information in the US. Employers who are global will also need to consider the agencies and applicable laws to that country that could be very different than what we're seeing here in the US. All right, so COVID-19 current trends. This is as of July 21st, 2021. As you can probably anticipate, this is a continually moving target. These numbers are updated, hourly and daily. So I did put some dates around here on information, but we should certainly be able to see the trends as it relates to COVID-19. So there were, as of July 21st, 35 million coronavirus cases. Of those 35 million, 30 million were actually closed cases. So you can see the statistics year to date, or not year to date, but to date for the COVID pandemic. Coronavirus deaths are at 625.4, which is a 2% mortality rate. And then coronavirus recovered, 29.4 million at 98%. So just to kind of give you a volume of the scale of the number of people that have been affected by it, deaths, and those that have been recovered. So COVID-19 current trends from the CDC. And again, this is of the previous, rather this week. Daily cases are up 69.3% compared to the previous 7 days. And that's as of July 14th. And I'll share a little bit about why I think that is. I'm not a scientific expert or a health expert, but it doesn't take a rocket scientist to figure out that we have opened up. People are traveling more than ever. Restaurants, schools, and all facilities are open. There's still some areas where there are some restrictions, but for the most part, all opened up. And I think that's just part of seeing us open up. And people that are vaccinated, CDC says that 48.67% of people in the U.S. are fully vaccinated, so just a little bit under 50%. And then we have 56.1% have had one dose. So almost 60% of folks in the U.S. have been at least received one dose. Vaccine administration is down by 35.7% compared to the previous 7 days. So that's somewhat interesting in its own point. We have seen a decline since the peak sometime in early and late May. And so, that trend, I think, has some arguable statistics as well, and we'll talk about that. There are several SARS-CoV-2 variants circulating globally. And here in the US, we have 4 variants that are areas of concern. We have the Alpha variant, Beta, Delta, and Gamma. And the one that's most prevalent that we hear a lot about in the news and it's been, talked about a lot is the Delta variant. Delta being the most prominent. The CDC predicts that almost 60% of the new cases that we're seeing in the last month or so are attributed to the Delta variant. This is a variant that's a lot more contagious and a lot more prevalent. And so I think that is also contributing to some of the rise that we're seeing in COVID-19 cases, and something, of course, that we'll be watching and that will be having an effect on the folks that are, needing the vaccine or waiting to get the vaccine. All right, so let's take a look at some of these numbers statistically just on the graph, because I think sometimes the picture paints a thousand words. And so you can see here, this is a number of new cases reported in the US. You can see here that we kind of peaked in January. You can see that number here, and you can see that we've steadily declined. We had a little bit of a peak in April and then a continued decline. And you're seeing right here as of July 19th that number again is rising. And again, I think just because of the situations where, we're opened up, even though 50% of people are vaccinated, I know at least in my home state, go out to the store, nobody's wearing a mask. You would expect that if only 50% of people are vaccinated, 50% of people would be wearing masks, but that's certainly not the case. So I think that just will add to, probably some of the cases that we'll see going up in the next few weeks as far as current trends. This one's an interesting slide. This is actually the CDC's statistics on the population that has received the vaccine. 56.1% of the population has had at least one dose, and 48.6, almost 50% are fully vaccinated. You can also see the statistics for the various age groups greater than 12. We're looking at fully vaccinated, almost 60%. And probably the most impressive here is the 65 and over. We know that's the higher risk group. Those numbers are approaching 80% fully vaccinated. 90% are for folks that are at least receive one dose. So we do see that, there are large numbers in certain age categories that are receptive and have taken the vaccine already, based on the CDC's numbers such as of July 19th. All right, so the COVID-19 vaccine administered current trends. You can see here that there's been a steady decline since May. And I think part of that is some of the statistics we'll talk about here in a little bit, or some of the call outs, is that I think that there's an element of the population that is waiting for us to have a fully approved, FDA approved vaccine. And that there's a significant portion of the population that's going to be waiting. But you can see here that that significant drop, and here July 20th, almost to nil. You can see here almost at the very bottom of the graph. I do see that there are spikes of missing data here, and you see them pretty regular. I'm not sure exactly what's causing that, but there's got to be something statistical or the way the data is provided. And so it's a little hard to react to that at this point right now, only knowing that there's continued downward trend to people that are currently receiving the vaccine. All right, so the big question, should employers encourage or mandate vaccines? Good question. And I think the information that we're going to share through the rest of the webinar kind of help determine what we think employers will do, or what employers should do, or what they want to do. But probably the biggest challenge out right now that I think has been out in the media and pretty public, or some of the public lawsuits that are out there involving organizations that have mandated COVID-19 vaccines. The one that comes to mind for me the most is the hospital workers at Houston Methodist. A federal judge in Texas upheld the hospital system's mandatory COVID-19 vaccination policy by dismissing a lawsuit that claims that vaccines against the coronavirus are experimental. The lawsuit was filed against Houston's Methodist by 117 unvaccinated employees who were told to either get vaccinated or lose their jobs. There are other high-profile cases that have been in the news here: North Carolina Sheriff, Los Angeles School District, and the New Mexico Detention Center. Which I think kind of takes us to that second point in the slide, that currently vaccines only have emergency use authorization. That is how we are able to administer vaccines to the public. Since they don't have FDA approval, they are administered through this emergency use. And of course, that's causing a lot of controversy or a lot of concern with people who are either expected to take the vaccine or considering taking the vaccine, because it has really not been fully approved by the FDA. It's believed that the CDC says to believe that nearly 1/3 of unvaccinated individuals are waiting for that full FDA approval. So once there's full FDA approval of the vaccine, I think that's going to really change how folks are thinking about it, and I think it's going to change how some of the laws are being applied. I think it's going to mean some big changes. So we'll need to watch for that. I didn't see anything in my research that says when that might happen, but it is something that I think as employers we should watch, because it will change the COVID-19 vaccine landscape for all of us as we're waiting and finally do get that FDA approval. According to the U.S. Census Bureau, 4.4% of employers are currently requiring vaccinations. That's up from 2.5% in April. So, in retrospect, from a national standpoint, that's actually a pretty small number. And I think that there are some organizations that are out there, like public safety, healthcare, schools, that believe that mandating and forcing their workforce to be vaccinated, and they're taking that stance. I think for the most part, employers are still kind of waiting to see what's going to happen, and waiting to see how they're going to manage, employee vaccines, or requiring or validating that employees have had their vaccine. So there are lots of organizations that are out there that are watchdogs, like the EEOC, the Department of Labor, and all of these really large organizations have been very gray in how they're interpreting the law. And really, I think this is just because it's completely undiscovered country, right? And the agencies are certainly struggling with it. Laws are unclear, and what is being done out there is being scrutinized, but it's being reviewed in a way that's very general. So that kind of leaves employers exposed right now, in that even though organizations like SHRM and other business organizations are really pressing and asking these agencies to provide more guidance, it's been really difficult. As a matter of fact, the EEOC in late December of 2020 had come out with some proposed rules around incentives and other things, but with the change in administration, the Biden administration kind of put a squash on that, citing leadership changes and director changes and more input, that the EEOC had to dismiss those. And as of June 28th, I provided some guidance and FAQs for employers on how to proceed with some of these topics. Now, I've included a link in the resources link at the very end. I've done a lot of research and went through a lot of time to find all these links and put them for you, so they're very easy for you to find. Just click on them. We don't have time today, obviously, to go through all of the EEOC FAQs, but I did want it to hit some of the highlights. So first of all, the EEOC does not supersede the CDC, state and local governments, and public health authorities. And that is, I think, makes this particular topic so complicated, is that, as we know, being in the human resources field, or in the payroll field, or others, that the federal law is usually very general. There are state and local laws that are out there, and the stance is that if the law is more favorable to the employee, that those local laws will be followed, or those state laws. And so while there is some guidance from the federal level, there could be significant changes when it comes to state and local. So it really is important that employers are navigating that in their territories, in their local areas, and if they're in multiple areas, making sure that they have a clear understanding of that. Now, generally, businesses may require workers who enter a physical work site to receive a COVID-19 vaccine without running afoul of the federal workplace anti-discrimination laws that the EEOC enforces, with that caveat that it's not superseded by some local or state government or agency. However, employers must consider reasonable accommodations for workers who refuse a vaccine for religious or disability-related reason, unless such accommodations pose an undue hardship on the employee's operations. Okay, as a best practice, before instituting a mandatory vaccine policy, employers should provide managers and supervisors and those responsible for implementing the policy with clear information about how to handle accommodation requests that are related to the policy, says the EEOC. And so probably, and we'll talk a little bit about this in best practices, but probably the good rule of thumb here is that reasonable accommodations should be considered. We should probably be a little bit more overzealous in accommodating those because in some cases, employees do not have to cite religious or disability as a reason for refusing the vaccination. And so we want to be really careful that if there is a mandate for vaccine, that your managers and frontline supervisors are really trained to understand what the employee is asking for, and that there is a good cause to approve a reasonable accommodation for that particular employee. Carefully consider incentives. And so this is a big one. Requesting proof that employees receive a vaccination on their own is not a disability-related inquiry under the ADA, and therefore any employer may offer an incentive to employees to provide such proof, according to the EEOC. If an employer administers the vaccination to its employees or contracts with a third party to administer the vaccines, then any incentive the employer offers with the vaccination must not be so substantial as to be coercive. The reason for this rule is because administering the vaccine requires pre-screening medical questions that are prohibited under the ADA unless the medical questions are voluntary. So the law is very specific, and we're starting to touch other protected rules and laws for employees. So we need to be very careful, and we'll talk about best practices and how to consider those incentives, how to consider that information in your employee engagement plans a little bit more. But just kind of the general gist is be careful with incentives. Don't make them so high that they're coercive or force somebody to participate, because then you could be violating ADA, GINA, and other rules that are out there. Beware of disparate impact. The EEOC says to be aware of disparate impact. And even though mandatory vaccination policies may be permissible, employers should be mindful of any disparate act that a mandate may or have on a particular group of employees. And remember, disparate impact means that a seemingly neutral policy is discriminatory in its practice based on age, national origin, color, religion, sex, or other protected category. And this can be unintentional, right? Many disparate impacts are unintentional, but they favor a particular group. So EEOC's recommending to pay particularly close attention to your policies and that you're not retreating any disparate impact. And then lastly, EEOC is saying keep vaccination records confidential, okay? The ADA requires employers to keep employee medical information confidential. The EEOC's guidance confirms that even though requesting proof of vaccination is not a medical inquiry per se, the information that employee provides about vaccine status, such as a copy of the vaccination card, is considered medical information that must be maintained confidentially in a file separate from an employee's regular employment file. And so while EEOC is taking a stance and saying, look, you need to be careful what you do with that information, you should keep it in a separate file, it really does open Pandora's box. A lot of legal experts are concerned because in most cases it is considered medical information, could be subject to HIPAA, and HIPAA have more stringent policies on how that data is housed, how that data is stored, what happens if there's a breach of that data. As a matter of fact, in my research, I found that the state of California recently activated a law making it pretty hefty fine for a breach of these vaccination records, as much as $750 per employee. and that there are 25 other states that are following suit. So, this landscape that we're talking about, of vaccine mandates and how they affect the employer. I mean, the laws are changing constantly, if not, weekly and daily. So we want to keep an eye out for those things, and we want to see what local and state authorities are implementing, and we want to be very careful. We'll talk a little bit here in best practices of some of the things that we might be able to do to keep that risk minimal. But at the very least, making sure that those records are definitely confidential, and not part of the employee file. Or remember that managers, frontline supervisors may have access to those files. We don't want them to have access to medical information. All right, so let's talk about some potential legal issues. As already discussed, there's so many considerations in mandating vaccines that affect the American with Disabilities Act, the ADA, GINA, the Genetic Information Non-Disclosure Act, and Title VII of the Civil Rights Act of 1964. So all of that regulatory information is problematic, right? Because every one of them is protecting a different thing. And with employee vaccines, we're kind of touching on all these additional topics. One of the other things that could be potential legal issues that I discovered in my research is that when you're incentivizing employees and you're paying them, those do become subject to what I'm going to call FLSA rules, Fair Labor Standards Act, where those non-discretionary bonuses, right, because they're offered to everybody, could be considered part of their pay. Affect overtime calculation does really get complicated, and should be something that your organization should be thinking about as a potential risk. We've already talked a little bit about the incentives that could be too high, that would violate ADA and GINA. We're basically saying that offering thousands of dollars for being able to force per se or coerce employees to participate in a mandate, or a voluntary rather, that there could be some potential issues there. So again, something that you want to keep it simple, and you definitely want to seek some guidance on what that maybe that number is. There's no magic number out there. Nobody's committed to that, but we don't want it to be extraordinarily high either. Regulatory uncertainty and constantly changing, making it risky. So potential issues that the landscape is constantly changing, and you're going to have to be able to react and make changes based on what's happening out there in that landscape. Proof of vaccinations could be considered medical information that is subject to data and data breach requirements. I think this one's going to become more real here in the next few months as we get our handle on employers who are asking for proof of vaccinations. And then, of course, privacy concerns. I mean, if you think about it, it's unprecedented that we would be asked for medical information, which is a proof of a vaccine before getting on a plane, or before entering an airport, or before going into a big venue like a concert or a sports game. So, I think that people are reacting to that. I think that states and local governments, as well as the federal government, will react to that at some point, and there will be some changes there on how some of that information is managed and taken care of. So, these are all potential legal issues that an employer should be watching and keeping close at hand. Best practices. Ultimately, I think what we're saying here, I think what the EEOC is saying, I think what SHRM is recommending is that the vaccines are voluntary versus mandatory. I've already spoken about, public safety and healthcare, where some of those are probably required, but for the most part, those industries that don't fall in there, probably the safest bet is to have a volunteer vaccine program. And whether you're, mandating that, or you're making vaccines for employees voluntary, clearly communicate what that intent is. and make sure that there's clear indication from your managers, your frontline supervisors, and your employees what your communication about your vaccine policies. So there's no misunderstanding, there's no lawsuits, et cetera. Making sure that you're defining procedures for reasonable accommodations, or making sure that you're training your managers and that information is in their hands, and that you're being more accommodating. I don't know if I could use that for accommodating on reasonable accommodations, but in other words, taking the high road and maybe approving one versus not approving one, just kind of based on the legal landscape. Making incentives voluntary and tied to employees' proof of vaccination. Again, just kind of a best practice. Employers should consult with local and state authorities and occupational safety and health administrators that may have very different requirements. So I think it's going to be up to the employer to navigate this complicated landscape and make sure that they're keeping up with the local laws and state laws in their particular jurisdictions. And then have a policy for data storage for proof of employee vaccinations. We talked about separate employee file, but if those are being held electronically or being stored, consider making sure that those policies are very clear and that they meet all the local standards so that you don't have a breach. You're not subject to very heavy fines and more importantly, having to disclose that breach to the public. So, making sure that this goes beyond keeping a paper copy or a photocopy of this in the employee's personnel file, but go on beyond that in data storage, electronic data storage, breach, et cetera. All right, so a couple of other things. There are a number of policies that I would recommend you have in your arsenal. Those of you that are members of SHRM and not just a SHRM certification, but actually pay for the subscription, SHRM has a wealth of knowledge and sample policies. I'd be glad to share anything with you that I have, but at the end of the day, these are things that you're going to want to work, even though you may have sample policies and forms, something that you would want to run by your legal counsel as well as your HR departments to make sure that they fit and meet the requirements of your organization. But there are many checklists, FAQs in the resources linked. I did keep a lot of those available to you. There are posters, PDFs that you can download. So there's definitely a wealth of information that's out there. There shouldn't be any reason that we're not able to provide that data. And one of the things that I think comes back full circle is that there is a way to disseminate this information. HubEngage itself is an employee engagement and communication tool that allows you to educate, communicate, provide information. And so whether that's HubEngage or any other agent, a vendor that may be out there, there are easy ways to get this information disseminated and over to your employees so that everybody is properly communicated with and understands what to do. Okay, so if you have any needs for those, please reach out to me. I've had attendees before ask for copies of the presentation, copies of any sample forms that I have, and we're glad to provide that to you. All right, I want to leave you with this perspective. This is a SHRM COVID-19 research survey, and this was conducted this year. And there's a couple of things here that I want to call out. First of all, in their research, they found that employees that were surveyed, 28% of US workers are willing to lose their job over the COVID-19 vaccine. And I think the way that this was presented, are you prepared to lose 1 in 5 employees by mandating a vaccine? As we saw in social media over the last few weeks, this is a very big topic and passionate topic for employees out there. And in prior seminars, the future of remote work and others, there are organizations that, or rather employees have said that if they are forced to return to work, there's a high percentage that would also quit. And so this is really kind of funny, not funny, but how it's full circle, Yash, and that it really all comes back down to employee engagement, right? Um, Being connected with our employees, providing that information, being cognizant of what is driving that employee engagement and also driving that employee dissatisfaction, forcing employees to take the vaccine, forcing them to come back to work. And then 34% of organizations unsure if they're even going to have their employees return to work for all various reasons. But many have factored that they're saving money on real estate, they're saving money on utilities and costs. People are more productive, and so there's just a lot of factors. But these particular statistics are, in my opinion, pretty profound. All right. So in conclusion, COVID-19 vaccine. What are we saying? I think that initiating a voluntary vaccine program versus a mandate is probably the way to go. Again, each organization is going to be different, and there's some organizations that may need to mandate. But I think through proper education, through proper communication, that you can lead a voluntary program very successfully and still get people to participate voluntarily and really potentially leaving a lot of those potential legal issues out of the way if you really stick to a voluntary program. Link incentives to only volunteer programs. So again, kind of that big theme, all voluntary. And then of course, watch for the new and updated regulatory guidance from EEOC, local and state authorities, and occupational safety and healthy administrations, because those laws are continually changing, and it is basically a moving target. All right, so just one last thing. I put a lot of links out here, folks, for you to be able to go and hit. So just really quickly, obviously they're the SHRM resources. This is a pretty cool website that lists all the state and territorial health departments by state and allows you to access their information from one place. So that was provided by the CDC. So I think that is a great website to bookmark. A couple of news stories on Houston Methodist and ABC on the COVID vaccine policy I thought would be helpful. And then the EEOC has that FAQ I was talking about here. This is an excellent link. It's going to lead you to questions. There's even a seminar, video seminar, a short one from the EEOC on their stance on the highlights that I talked about. And so that information is available to you here on the resource link. And then let's see here. Got some OSHA stuff for you here and some publications from the EEOC. I have ADA and GINA information links for you there, and then of course SHRM's policies, a link to SHRM's policy there in the resource link. So hopefully those will be helpful to you and will allow you to access that information quickly and freely. All right, so I don't see any questions in the chat. So Yash, I don't know if you have anything to add, but if not, we'll end the webinar.
Oh, this is very informative, Chris. Thanks for the presentation and the slides, and thanks for everybody for joining today.
All right, thank you guys. Have a great rest of your week. Thank you.